So, Dr. Scholz, we've been talking about people who have urinary issues, and they're concerned that those symptoms of urinary issues could also be prostate cancer. Online, we have so many different things that come at us, and a lot of these prostate cancer videos often say prostate cancer symptoms, and a lot of what they're listing are really urinary issues. In previous videos, you've mentioned BPH, prostatitis, and the concept of an overactive bladder. So I thought today we would cover what an overactive bladder is. I'm sure you have prostate cancer patients who also have overactive bladder issues. So what is overactive bladder?
Yeah, it's good to be reminded that prostate cancer, until it becomes very advanced, doesn't have any symptoms whatsoever. But prostates and bladder-related issues are very common as we get older. And the overactive bladder idea is when patients come in asking, why do I have to go to the bathroom more frequently? Why am I waking up at night more frequently? Or why do I have this sudden strong urge to urinate, which is almost, I can't even control it sometimes. That would be called an overactive bladder type symptom complex. Well, there's a couple things. One is the general belief or practice that 8 glasses of water a day is somehow going to make you a better person is pervasive throughout the culture. And that I know of doesn't really have any great benefits, but it certainly does cause people to urinate more frequently. So how much water you take in will reflect in how much people are going to the bathroom. So not everyone makes that connection. And in particular, drinking a lot of water before you go to bed is going to cause people to wake up at night. But there's something beyond that. The overactive bladder has to do with the contractility of the bladder and the things that trigger the urge to urinate. As we get older, many of us are discovering that our urges, our desires, and our ability to see and hear are all being diminished as we get older. And this phenomena with aging, if it's reflected in the urge to urinate, if that is diminished as people get older, prior to the advent of modern medicine, that would mean you would die. You would have kidney failure and die. And so there is a mechanism that's built into the human condition so that as people get older, their urge to urinate actually reverses and goes up. All our other urges are going down, but the urge to urinate goes up. And this is a protective mechanism. We didn't used to have catheters and urologists and blood tests to measure kidney function. And if people lost the urge to urinate, they would develop kidney failure and die. And so the urge to urinate in elderly people was actually protective to keep the genitourinary tract functioning and allow people to live into their old age, albeit with the inconvenience of having this increased urge to urinate.
So how do you determine when a man comes in with these urinary symptoms that it's an overactive bladder versus BPH or versus prostatitis?
It's oftentimes difficult to ascertain. Sometimes we approach it just with sort of a trial and error process. We'll treat it, try and modify water intake and whatnot. The urologists do have different tests that they can do to evaluate if there's, for instance, blockage through the prostate. They'll do an ultrasound after urination to see if the bladder's emptying normally. They'll do tests called uroflow studies. They'll look at how quickly the urine is passing. But part of it's just taking a history and talking to people and finding out how much water are they drinking and having them describe their symptoms. Is it a strong sense of urgency versus slow urination versus other symptoms? So it's a diagnostic process, but oftentimes it just comes down to, well, why don't we try this for a little while, see if that helps? Because really, we're not talking about an underlying dangerous illness. We're talking about improving someone's quality of life. A lot of people come to the doctor with these symptoms. Is it cancer? Is this the beginning of the end for me? And when we can reassure them that this is part of the aging process, it has nothing at all to do with cancer, they'll say, oh, I can live with these symptoms. But they're just trying to be cautious and make sure that if these symptoms are signaling an underlying problem, they want the doctor to know about it and make sure that it's not something more serious.
So what treatments are there for overactive bladder?
The medications that reduce the contractility of the bladder are available on the market, medicines such as Vesicare or Mybetriq. They work directly on the wall of the bladder and make it less contractile. They're effective and they can make a big difference and they're popular. The issue sometimes in men that have overactive bladder and a big prostate if you administer these medicines in someone that already has very slow urine flow because of a big prostate pushing on the urethra, you can actually make that problem worse. So sometimes they're given in combination with the alpha blockers, which relax the prostate first, and then you add the a second level of anti-bladder spasm medicines like Vesicare or Mybetriq on top of it, and they can make a big difference. They're not going to be effective in everybody. Mybetriq seems to have less side effects than Vesicare, but it's quite a bit more expensive. Vesicare has been on the market long enough now to be a generic, and sometimes it'll cause a little dry mouth, sometimes a little constipation. So all these things have to be balanced as to whether their net effect is an improvement in quality of life, and it's an individual thing, and it varies from patient to patient.
With Mybetriq and Vesicare, what are the measures of success? Like how soon will the patient, feel relief from those issues? What does success look like with that in that context?
The effects are pretty quick. Within a week or so, people should notice an improvement, less urinary urgency, less urinary frequency, and at the most 2 weeks, I would say. If people are not noticing a worthwhile improvement in symptoms within that time period, then they need to think about going a different direction. These are effective, but they're not effective in everybody. So there's a big component of trial and error in the selection process for these medications and whether or not you're going to stay on them long term.
So for patients, it's a huge relief to know that from an aging standpoint, that could be causing the urinary issues instead of prostate cancer, and that being symptoms of that. But you have a lot of men who have prostate cancer and an overactive bladder. Could an overactive bladder and Vesicare and Mybetriq, taking those types of medications for that, ever inhibit or cause a change in decision-making when it comes to prostate cancer treatment and choosing a treatment?
No, I don't think so. I think the only side effect we haven't mentioned is sometimes we'll see a little bit of increase in blood pressure, so it's good to have a blood pressure cuff at home and to track that. If the medicines are giving really great relief and you want to stay on them, but the blood pressure is going up, you can take a blood pressure pill to compensate. So there's a little bit of a juggling process in terms of what people's priorities are. For the most part, we're not forestalling a progressive, dangerous illness. What we're just trying to do is give better quality of life. People have to decide whether taking a pill is worth that. I think many of us think of taking a pill as a reduction in quality of life, and it's something that people only want to do if they're really forced to do it. So if we reassure them that these abnormal urinary symptoms are not dangerous, but merely a manifestation of inconvenience and aging, sometimes people don't want to take any treatment, or they just cut back on their fluid intake. But for others, if they're waking up 3-4 times at night and can't get a good night's sleep, the use of these medications can make a big difference. Another simple measure that has helped some patients is taking a mild analgesic at bedtime. If you recast the idea of urinary urgency as a form of discomfort or pain, you can see how taking something like Aleve or Advil at bedtime might reduce those urges and allow people to sleep through the evening. Those are well-tolerated, available medications over the counter. And
you could take those long-term, like you could take Vesicare, Mybetriq, and maybe a mild analgesic as well.
Yes, if you think of the dangers of taking a Aleve at bedtime, people need to watch out for heartburn. If you take a single medication at bedtime, there's very unlikely that it would have any impact on kidney function, and those effects are usually reversible. So these are pretty safe, and I think that's why they're available without a prescription.
Hey everybody, I just want to take a moment to encourage you. You're doing a fantastic job by going online, educating yourself about this disease. We know you have a lot of treatment decisions that are coming up, but I want to remind you that your quality of life matters. And I know you're like, Alex, you don't have to tell me that, but I want to remind you that the medical system and everybody else isn't going to know the greater context of what you're dealing with. Only you know. So thank you so much for watching these videos and staying educated. I want you guys to go ahead and leave your questions and your comments and the topics that you guys want covered in the comment section below this video, and give us a thumbs up. It's not just to say, hey PCRI, you're doing a great job. It's to let us know that you appreciate this type of content and that you want more of it. We want to answer your questions. We want to be here for you. It's the entire purpose of PCRI, and we're very grateful for this opportunity. Thank you so much for watching these videos, and I hope you have a great week.